such a complex topic that we're talking about today, such a hot topic as well. We get a lot of questions in our online support groups about medication side effects. I just got to clarify that in this event, we are not going to talk about specific side effects for specific drugs or medications. We're going to talk about how we can navigate those side effects from different medications. So I'm going to start just with an introductory question. It's a review of the different types of medications and typical things that people may expect to experience with preventives, abortives, and rescue medications.
I think that those are very big groups and categories. I feel like if we're looking at newer, I'm just going to go with newer preventatives, whether the injectables, honestly, most common injection site reactions, constipation, that's what we see most commonly. With the older classes, when we say older doesn't mean they're not as good, they just were older before 2018 of the preventative medications. I think it really did depend on the specific medication. For example, beta blockers might cause some dizziness because of how they work, or fatigue, whereas some of the antidepressants can cause dry mouth or fatigue. And then some of the anticonvulsants might cause tingling, hands and feet, dizziness, weight loss. Like, I feel like it really just depends on the medication. But that's sort of a broad overview for the rescue medications. I think if we're just looking at the most common one that I see is the triptan effect, which is, I feel like, side effects, but people feel like they're not tolerating it. But basically what we expect with the triptans is this warm sensation coming over your body. You can feel your heart racing. You can feel tightness in the jaw, in the neck, sort of just an overall just rush of feelings. And I think that's the one I hear most common, is that the triptans just really, I'm having bad side effects, but actually that's the kind of normal expected triptan side effects. Some of the other newer rescue medications are usually pretty well tolerated. The gepants usually just nausea in some people, maybe some fatigue, but overall super well tolerated in my experience.
Wonderful. Thank you so much for sharing that. So let's just start off with, in medical speak, what is the difference between a side effect and an adverse event? And at what point should we be concerned that a side effect is actually becoming an adverse event?
I love this question because I feel like this is something that we really don't speak about. But a side effect is a known and expected reaction to a medication. So basically, when you're looking at the label, it's something that was seen in clinical trials. It's something that is mild and is in the known medical literature, and we expect it to happen. So it's something where I tell my patients, I would expect this medication to make you tired, or I would expect it to make you dizzy. Whether it does or not, not sure, but it's expected. And when we think of a side effect, it's something that's usually manageable and should lessen over time as the body adjusts to the medication. I usually liken it to, nobody likes jumping into anything. Anytime we change something, there can be this adjustment period. So it's like a honeymoon period for the medication and the body getting used to it. An adverse event, on the other hand, is something that we're not necessarily expecting. It's an undesirable effect, and it's not something that I would tell a patient, I expect this to happen. And it's usually unexpected, and it can be more serious. It can obviously range from more mild to more severe, but if it's something that I would not expect it to happen, and also it doesn't necessarily have to be due to the medication itself. For example, an adverse event can be somebody got, I'm just going to make up, the flu, and I feel like they got sick. And I'm like, well, was it the flu or was it the medication? I don't know. It's just something that was not expected that would happen. That's a really bad example, but I'm just trying to make an example. But basically, it's not expected, and it's something that definitely is just out of that ordinary. You wouldn't see it listed on a side effect profile.
Right. Absolutely. That's a great answer. And then at what point do you think that people should be concerned? Like, at what point should they, if they're thinking, maybe I have a side effect or I have an adverse event, at what point should they be talking to their doctor and saying, this is going on? I think this is going on with this medication.
Yeah, I think that we should always keep note of side effects. I always like it for my patients to let me know if something is not tolerable. So a side effect can be tolerable, intolerable. And I think at the point where it's bothering you and interfering with your ability to function is a point where you should tell your doctor.
Right.
In terms of side effects, if it's an expected side effect, then if it's disrupting your life, tell your doctor. If you're experiencing symptoms that are not expected, like you have trouble breathing or you have a rash, or you tell your doctor right then, like you don't wait. But I feel like it's never wrong to tell your doctor. I know there's different access to doctors, but
Right.
I would say if someone takes a medication and it's been 2 days and they're feeling tired, I think that's something to note, but unless it's preventing functioning, it's not something you necessarily have to tell your doctor right
Right.
then. I would give it some time.
Right. That makes a lot of sense. So let's talk about, if you think that you're actually experiencing that, what are the different ways that you should report it? Because we know, especially for newer medications, there's still a certain time period where we may expect to see new things that didn't show up in the clinical trials because it's real world use. So if someone's experiencing a side effect from a medication or a new medication, especially, where can they report it other than just telling their doctor?
Yeah, so usually the FDA has like an FDA MedWatch, or there's clinical reporting sites for new medication where you can report it. I know in the beginning when some of the newer medications came out, as doctors who were prescribing them, we have to report to the companies. I think it depends on how far out from clinical trials it is, but I will say with any new medication, you have side effects that are seen in clinical trials, but later on, yeah, sure, there might be post
Right.
hoc
Right.
analysis or more patients coming forward. So always
Right.
something to report, tell your doctor, and then report to the appropriate place. Usually it's in the FDA.
Right. And I know that some of the pharmaceutical companies, some of them actually publish a number. They say, if you experience a side effect, please call and let us know as well. So that's a good thing to do. Why is it so important? Like we're always telling people in my community, it's really important if you think you're having a side effect, report it, especially if it's something that's been recently FDA approved. Why is that an important thing? How does that impact the future of what may be on the medication guide, or, help other patients, for example?
So I think that we're interchanging side effect and adverse event in that sense. So I feel
Right.
like if it is something that is like something that is really severe and it's something that is not on the label and something that could jeopardize someone's either life or productivity, then yes, report it. I would say if it's something that is not on the label but cannot definitively, like, I think fatigue is like not, I mean, fatigue, so many medications cause fatigue, but I think if it is something that isn't it's hard to say. It's like, I feel like if you're having side effects, like, yes, it could be due to the medication, but we also have to think about, could it be due to something else? Are there
Right.
confounding variables?
Right.
I think it's never wrong to report, but I think the difference between a side effect and adverse event, I think when we're saying report for new medication, if you're having
Right.
side effects, I do think what we're trying to say as a medical community is if you're having an adverse event, something that would not be
Right.
expected or something that isn't
Right.
serious. And again, I think it's hard for me to say serious is very dependent on what it is, who the person is. So if all else fails, why not report it? Like, and
Right.
why not tell your doctor? Because it's better to be safe than sorry.
Right. Absolutely. And I know that there were a couple of medications that have already updated some of their medication side effects. So post-marketing side effects is where you can find them in the medication guide. And that's because doctors obviously have reported them, and also patients. So just, I'm just going to encourage people who are here today, who are watching, and we encourage people in our groups, if you think you are having an adverse event, then please report it to your doctor, but also report it to the FDA and to the pharmaceutical company, because that way they can gather everything that's going on and hopefully try to figure out what is correlation and what is actually causation. So like you said earlier, you said it was a bad example. I think it was actually good. Just because you get the flu after you start a new medication does not mean that medication caused flu. It's just happened to correlate at the same time.
I think
And
hair loss, like, I mean,
yes.
I hate the hair loss. I feel like I'm one that suffered from that, but I feel like there's been a lot of having hair loss. And I think with people having COVID would have hair loss, the medications with hair loss, and it was very difficult for me, especially with my patients, to determine what here is causing the hair loss. But then I have to look at, are you better on the medication? Is it worth it? If the medication was having that side effect, would it still be worth it to be on it? And I think that's the question that we have to ask, and where I always judge with a side effect.
Yeah, absolutely. That brings us perfectly on to the next question, which is, how can patients best figure out, and there probably is no best as in one way, but how can we figure out potential risk versus potential benefit when taking medications for migraines? So I'll just say for myself, I'm so desperate for something to stop my migraine attacks because they are so debilitating that I'm willing to put up a lot of risk because of that. And someone else may have a barrier that's much lower than that. So, how do you see that? What would you tell people?
I love this question because I feel like this is what goes through everyone who has migraine head when you're like, do I treat? Do I not treat? If you have medications that cause side effect, it's like, do I want to take it so I feel not so great, or do I not? So I feel like, yes, for the acute treatment, if the medication is going to give you more side effects, even if it gives you some benefit, it's always do I want to in that moment? And I think that that's where some of the newer medications do shine in having lesser side effects, but we also can do combinations of therapies. It doesn't have to be I have a side effect or nothing. And then in terms of preventative medications, I will say, yes, there are potential side effects, but side effects do get better with time, and there are ways to make the side effects better. For example, if somebody's getting nauseous, there are ways to mitigate, I hate to always add another medication for a side effect, but you can. There are ways to take it with food. There's different ways to adjust taking it. And I always feel like we have to try in order to know if it's beneficial. So I'm like, let's try it and say, does it have benefit for its purpose? And then we can decide, is it worth taking if the side effects are intolerable? But I think we get so afraid of the side effects not going away that it gets scary to say, well, what if those side effects just continue, or it sets me into a new symptom pattern?
Right, absolutely. And again, that brings us right into our next question, where we're talking about, the side effect. I know this obviously isn't side effect, but the risk to avoiding all medications, because we see this in our groups every day, every single day. People are saying, I'm scared to take this medication. I've heard of potential side effects or adverse events. I'm super nervous. And, one of the things I always say back to them is, what if this medication stops 50% or 75% or 80% of your migraine attacks? And like you say, we tend to spend so much time being afraid of what the treatment could do, we lose sight of how serious migraine is. So I wonder if you could just take a minute to talk about, the risk of avoiding all treatments, of not appropriately treating your migraine, and chronification and all those fun things that come along with migraine.
As you asked that question, I could think of a dozen patients in the back of my mind where I could sit here visualizing me pleading with them, please, like something, anything, because I'm watching them suffer, also watching them use a ton, for example, just this handful of patients, of over-the-counter medications, which we feel like are not as serious, but saying, I implore you, a year from now, if we don't make a change, we're going to be sitting in the exact same place, if not worse. So we know that the risk of disability, of chronification of migraine really goes up with not treating, especially not treating preventatively. And I think that there is definitely a fear of medication side effects, but it's also, I sort of get a feel of like, what happens if I feel better in a way? And I find that it all gets snowballed and snowballed and snowballed. So I would say the risk of not using prevention, I'll start with prevention. If you're having frequent chronic migraine, is much greater than the risk of a side effect that will go away. So side effects are transient, and chronification of migraine takes so much longer, much longer if ever to correct. So I would also implore people, I know that sometimes we say, my doctor's not really talking to me enough about the side effect risk. And I think it is a tough conversation to have. But if it is something that is truly preventing your ability to start a medication, I think we're going to get a little there. There are other things that we can do. And I think it's not all or nothing. It's saying, what is the best fit for me? And at what point is it enough where I want to move on to that next step and take that leap?
Right.
And then
Right.
for
Absolutely.
rescue, yeah, and then for rescue treatment, I think I'm okay depending on how frequent someone is getting attacks with not treating every attack with a medication. That's where we can also get into some other treatments. But I also think the risk of leaving migraine untreated to some degree is worse than potentially the side effect that will be transient and resolved. So not an easy question, but I
Right.
think that the risk is more with not doing than it is with trying and doing.
Right. Absolutely. And, this is, I don't know if we've talked about this at conferences or not, but this is a topic that I'm particularly passionate about because at my age, there were no preventive medications available for, almost 2 decades of me having migraine attacks. And so I live with those consequences now. And I think it's very hard for people to understand when they first start getting migraine attacks, or let's say that they're not really lowering their quality of life dramatically enough. It's hard for them to realize or even know that this is a disease that can chronify. This can get worse. And if it gets worse, it is so much harder to reel it back in, right?
Yep, it
It's
really
just
is.
tough.
And I just feel like I see it happening and I'm just like, okay, we just do something. We got to stop it. We've got to just like try to hit pause. And
Yeah.
I would never want to do what a patient is not comfortable with, but I always just wonder what would help to make someone more comfortable with going on a treatment. I think that's why it's important we have these discussions.
Right, absolutely. And obviously, not all of us want to do all different types of treatments. We have our limitations. And so, important discussion for everyone who's here, who's watching us. Have that conversation with your doctor and just talk to them. Open communication is so important. Before we get into what is actually probably our top question about side effects, which is rebound headaches. So, just to let people know, we're going to be talking about that medication overuse headache. Before we get to that, let's just talk very quickly about supplements, because that's another thing that we hear a lot is people saying, I just want to do it naturally. I just want to do something, that isn't medication wise. And so they want to take a supplements. So, but some supplements can also have side effects, right?
100%. I feel like I just say, but even placebo doing nothing can have side effects. So I feel like every potential thing, I always say crossing the street can have an effect. Like waking up in the morning can have an effect. So it just depends on what risk we want to take in the moment. So I do think that supplements, I think we think of these things because they're not prescription as being safer, but a lot are not FDA regulated. Half the time, to be honest, some of them, I don't even know what's actually in the supplement. So I'll always tell patients which brands I know are third-party tested and which ones we can trust. But half the time I'm like, are they getting what's in it? I have no idea.
Right.
And I will say patients also discontinue supplements because of side effects. So magnesium, definitely GI, diarrhea, nausea, and changing formulations can help. But I think that there are side effects, like I said, to everything, and thinking that just because it's natural doesn't necessarily mean it's safer or is
Right.
going to have, it's just different. It's different side.
Right. Yeah, I love those examples. So the example I always give to people is, if you go and chew some blades of grass, some of you are going to have a reaction to that. Even though it looks green, it's soft, it's natural, it's in our lawns, anything can give you some kind of side effect. We're not really talking about medical devices today, but I just want to kind of throw it in because it was a question we got when we were asking for questions, is that some people feel that the medical devices are a great option because of the lack of side effects. Maybe you could just speak into that for a minute.
I'm a true believer that everybody should have a device because it is more user friendly in terms of side effects. And I will say somehow putting something or wearing something that gives a local discomfort is a lot more appealing than potentially taking something that can have a more systemic side effect. But yes, you're not going to have systemic side effects from these. It would just be a local reaction, if any, whether it's the electrode that might have some adhesive, or it might be if you're putting something and it makes your skin a little bit more sensitive, not as big of a deal. So I do agree that medical devices are a really good, I wouldn't say alternative treatment. I find them all complementary. I find that just using a device it depends again on how frequent someone is having migraine attacks. Might not be enough, but everyone should consider a device because it definitely gives added benefit for very little to no.
Right. Right. And I tend to come from that perspective as well. I always tell people you should have a device. Try the devices. Just so people know, you can go onto our website, migrainemeanderings.com/devices, and you'll see information about all of them. But quickly, their names: Relivion, Nerivio, Gammacore, Cephaly, Savidual, and there is a header term that is also FDA cleared as well. So if you're interested in medical devices, we're not going to talk about that anymore here, but go take a look at our website and learn more about that as well. And again, not as something different or an alternative to medication, but just kind of add into your toolbox. It's great to have. So we're going to talk about this hot topic, rebound headaches. Some people call the medication overuse headache. Personally, I prefer medication adaptation headache because I feel that that's less kind of blaming of the patient, but it's so common. What is the best way to avoid this all too common side effect?
So I look at it less as a side effect versus the brain adapting, like medication adaptation headache, adapting to getting something and then needing more and more of it over time. It's not necessarily like, I don't say it's not addiction. It's the brain's receptors basically just changing due to use of medication. So I find that this is such a common thing, but because it's thought that it's over the counter, not a big deal, like it can't cause effects. So I think, first of all, the best way to avoid is to be starting on prevention when you're having 5, 6 migraine days a month, because we know that the more migraine days, or even the lesser severe of the migraine days that we have, as those numbers start creeping up, 8, 10, that's where we start having trouble. Because
Right.
if we're using over-the-counter medications, there's different thresholds based on which ones we're using. For example, I can go, if you're just using like acetaminophen or ibuprofen, we might have a little more leeway, up to 15 days a month before the brain starts adapting and changing, but that's only if
Right.
you're using those alone with nothing else. And I feel like most people are not just using one type of medication. So let's say you're throwing some Excedrin in there, and I feel like then we kind of, all bets are off, but then we lower our threshold to the number of days that can be used to about 10 days a month of all rescue medications combined, not including the Gpans. Those are a little bit different, but we think that at this 10-day a month threshold, the brain signaling starts to change and starts to produce pain in sort of response to the use of the medication. So the way I usually look at it is that if you're having more than 8 to 10 days of migraine a month, you have to be on a preventative, just because it's just at that threshold where things can really transform easily.
Right.
And giving that 10-day a month limit, saying 2 to 3 days a week is what I get to treat with an anti-inflammatory, a triptan, that is the number, and then checking it off on a calendar or saying, there's my limit. But I will say it takes time for this to happen. This is not like 1 month you're taking too much. It can take months to years to actually transform. I think the way I look at it when I look back in someone's history is, okay, things got a little worse. So we start using a little more medication without prevention, and then it just snowballs and snowballs over time. So I think the best way to prevent this is to be aware of it. I feel like this is not something that anyone advertises that will happen. I'm
Right.
like, yeah. So I feel like being aware that it can happen, and that it's not something that's your fault. I feel like if I wasn't a headache specialist, I don't think I would know this at all.
Right.
It's not something that's talked about. And just knowing prevention is your best friend in this sense. And then also trying to replace some of the medications that cause overuse with others that don't.
Right.
And we're able to treat more frequently than the 10 days a month, because we have a variety of medications that also don't cause that. I think before these newer classes of medications, it was a real challenge because we didn't have much that didn't contribute to this.
Right.
But I do think that more is not always better in terms here. And just because it's over the counter does not mean that it's, I like the word safer, or like less harsh or less strong. It's just
Right.
different.
Absolutely. Yeah. And I know we got some questions that kind of came in from this and some comments. The top one, of course, being, what do I do for the days that, go over above the number that you should be taking to try to avoid medication adaptation headaches. So I know for myself, and basically what you said is that, you can try the G-pants, which do not seem to have that particular side effect or that response in people. Obviously, the goal is to have better prevention. So you just have less attacks. I know for myself, it's not just the number of attacks, it's how long they last. People often don't talk about that. It's just like, I only have 1 or 2 attacks, but they don't talk about the attacks that last for days and days. And
It
so
lasted 2 weeks. I'm like, so you had one
yeah,
attack that lasted 2 weeks. I'm like, what?
exactly. How much Excedrin are you taking in that 2-week time? And so I know for me, every attack I can stop, I get super excited about. So, I have a device I use that stops some attacks. I have other medication that stops some, and I have all these different things. And so we encourage people to have a toolbox, and we encourage you to talk to your doctor about having a toolbox. We're actually going to be releasing a document next month that is a migraine action plan you can take to your doctor. And it talks about, what do I do when I first get an attack? What happens if that doesn't work? And then what happens if that doesn't work? So it's a much more comprehensive plan that you can put together with your doctor, and so important, because I totally hear you. If your head is exploding, you're not thinking about medication adaptation headache at that time, right? You're thinking, I've got to stop the pain. I need my life back.
I tell that to patients who come in, they're like, oh my God, I didn't realize this was happening. I'm like, of course, like, you're in pain. You're going to do whatever you can to try to ameliorate it. So I completely understand. I think my strategy has always been, you have your first line, you have your backup to your backup, then you
Right.
have like all breaks loose. What do you
That's
do?
what I say.
And so it's
Yeah.
also treating aggressive, like, again, different attacks might need different things, and knowing how to grade attacks and then knowing where to start. So for me and my patients, and I love the whole migraine action plan idea, I write it out and say, here's what you do for each scenario. And sometimes I might start with a device. Sometimes I might start with, actually, there are some supplements in higher doses I might use just to try to weed off. I might use intranasal lidocaine. There's like so many
off-label
things that we can use that don't cause medication adaptation. And then I have people diary it out. Basically, we see what happens and then see how to adjust it. But I think there's not a one size fits all. And I think that's what's really frustrating, is it's really simple to say, here, go take this, go take that. But the time it takes to actually analyze how you're doing that, what's working, in what order, is really time consuming, both on the patient's part and on the physician. So
absolutely. And that kind of touches on the topic we're going to be looking at next month with Dr. Gottschalk. We're talking about non-oral medications, because if you're taking a medication and throwing up, or you have gastroparesis or severe nausea, that oral medication may be the reason why you keep taking more and more, because it's just not working, and you may need something else, right? So just back to what Dr. Natbony said about having a little bit of a lot of different things. Again, you could go on our website, look at our migraine toolbox. You can check off everything on there that you've done, talk to your doctor about what you haven't. You can contact Dr. Natbony if you're in her area and go see her. She'll give you ideas. You can also go on our YouTube channel. We had a great video with Dr. Burke where he talked about off-label ways and creative ways to treat migraine. All I can tell you, folks, is that it's really worth getting creative and putting the time in. It's totally worth it. It's exhausting. And I always say, it's not fair. Yep, it's not fair. But this is your body and your life, and we have to work really hard, unfortunately, sometimes, to kind of reclaim parts of our life that migraine wants to take over. We have a question here from someone who said they have more than one chronic condition, which is probably the majority of people with migraine, especially for a while, right? And they take several medications. How can they tell if what they're feeling is a medication side effect, adverse event, or a combination, and which medication is causing this? We're talking about polypharma, right? I don't even know how you would begin to address that.
So the way I address it is looking at really good records. So the first thing is finding out what was the base, what they were on, or what was happening before things changed. And that's always really, really hard to do. But when things are added on, you have no idea. And it might not be one thing individually, it's the combination of all them together. So the only way to know is taking things off and then thinking which is the one that might be contributing to, but I wish I had a good answer for this. And I deal with this all the time, and it's impossible. Sometimes I'm like, you know what, let's just stop everything and then just restart, because I'm not going to be able to know. And the chronic condition itself might be causing it. But I do have a way to sort of tier and say, okay, let's look at the most common side effects for the medications you're on. Which one is more likely to have it? And then which medications might run through the same breakdown pathway in the body,
Right.
so they either enhance each other's effects.
Right.
And then maybe we would change dosing of one of them, or maybe temporarily try to stop one of them, and then saying which medications do you need to survive, either
Right.
physically, mentally, whatever it is, ones that we can't change, and then working around them. But that's
Right.
also where I try to use different preparations like injectables, Botox, oral, so that way we don't
Right.
have the same sort of interaction profile. But I think
Right.
that it's very complicated, and this is where like pharmacology really gets into it, and seeing a doctor who really understands how medications interact, which is a challenge. I completely get
Right.
it.
Yeah, absolutely. And I know that some doctors, they only want to consider their own specialty, the disease that they are treating you for. I've had doctors say, you've got to stop taking those migraine medications. But for me, the conditions I have go in a hierarchy, and migraine's at the top. So
Have to hire
everything else
for
comes
yourself.
under that. Right.
Yeah,
That's for
nobody can
me.
tell
That's
you
what I have.
unless, correct. If it's life, even if it's a life threatening, I want to say it's still our job as a doctor to
Right.
tell you, this is not our recommendation, but
Right.
there's always going to be a hierarchy. And that's what sort of needs to come through, is this is my priority.
Right.
And I basically chip away at the priority first, and then we can go to priority 2. But
Right.
I think that's also when there's chronic conditions. And for example, I see a lot of patients who have autoimmune conditions or rheumatologic conditions
Right.
where you have pain and are taking pain medication or anti-inflammatories for that condition. And you also have migraine. It's like, well, I know I can't take more than this because of
Right.
migraine. But I always say it's not that simple. The brain doesn't like switch all of a sudden and just say, you
Right.
know what, because you're doing that for this condition, I'm not going to make it have migraine worse. But just because there is a medication adaptation doesn't mean that every single patient will
Right.
necessarily experience it. So
Right.
obviously we always have to weigh risk benefits, and it's always a conversation, and then working with the other specialists to see how we can work on prevention for all
Right.
conditions.
Right. Absolutely. And then, this is probably logical to most people who are listening to this, but in case it's not, I'm sure that we all need to remind ourselves from time to time that the people who are the worst side effects tend to be the people who are online, because we're desperate. We're going to post about it. So
Yep.
if there were 100 people taking the medication and 99 people had no side effects and one person had horrific side effects, we're going to just hear about the horrific ones. We're less likely to hear about the amazing success stories and people reclaiming their lives. And so, yes, it can be scary, but we also need to kind of stop and think, okay, it doesn't mean it's going to happen to me. It doesn't even mean it's likely going to happen to me. And even if it does, maybe the benefit outweighs that risk, and the consequences of that.
But
This is
also,
an interesting, I'm sorry.
oh no, sorry. I also say, let's imagine the worst thing that could happen. This is what I sometimes say. And I say, okay, here's the worst case scenario. How do we deal with that? How long will it, like, if you can actually run through as a side effect, this is my worst case scenario, and we can talk it through and say we can get to the other side of it. I think that's important too, because I do it. I feel like I'm guilty of catastrophizing. Oh my God, what if this
Right.
happens? What if this happens? But if we can actually think about the real consequences of it, I think that's important in terms of our thought process.
Right. Absolutely. Definitely. And thank you for adding that. I really appreciate that. So question number 10 we have out here, this is kind of an interesting question. I think, I often ponder this a lot. It seems that some people rarely have side effects. And the person who sent this in says, I get every side effect there is. Why am I more prone to side effects than other people? Do we know why some people are just more sensitive to medications than others?
I have theories. I feel like
Okay.
I definitely think people with migraine are more sensitive to medications because our nervous system is just more sensitive. But I will say, even within the migraine population, there are some who you can give huge doses of medication with no side effects, and others that you can't. I think that there is some genetic linkage. I think there's different chemicals that break down medications in our body. And I think that depending on how your body is made up, you might be a slower metabolizer of some medications, meaning it takes longer for your body to break it down, which might mean it has more side effects. Some people might be rapid metabolizers, which means that they break it down fast. So the side effects sort of pass through their body. I think it depends on how our body and our chemicals sort of break down medication. I was trying to do a study on this about trying to look at breakdown products and how our bodies metabolize. But if I had to postulate into also looking at evidence, it seems to be that everybody's body is really just different.
Right.
And I don't have the perfect explanation. I also wonder if it's also the people who are not side effect people that are also going to try more things, and therefore their bodies get used to trying them. So therefore their bodies adjust and don't have the same degree of side effects.
Right.
Not really sure.
Yeah. Or maybe they're just the people who found something quicker that worked.
And I think
Right.
the faster you find something that works, like what I've learned is if you're someone who's coming to me, for example, with low frequency episodic migraine, and we're able to give you, for example, a triptan that you take at the beginning of your attack, you will have less side effects because we know that triptans work better when taken at the onset and have less side effects. So is it the course in the disease where you're seeing the side effects? We know that more chronic, and when you're trying to really treat at these prolonged attacks, there will be more side effects. So I will say, in my experience, yes, it does depend where you are in your disease process as well, but it doesn't mean that just because there are side effects, can't use the medication to get you back to a point where there might not be.
Right. It's so complicated. I remember when the CGRP inhibitors first hit the market in May 2018 and through the end of 2018, that it amazed me that there were people who were very, very severely chronic and who used to get side effects from almost everything. And some of them actually were like super responders to the CGRP inhibitors. And I remember thinking, how come, well, first of all, why is that fair? Because it's not, because we all want, right, to be that super responder. But I thought that was really interesting because it defied all logic. You would think someone who was the sickest and who had the most negative reactions generally, all of a sudden, they wouldn't experience this, and yet they did. And so it just kind of adds to the complexity, right?
The super responders, I'm like, it's because that was their protein. That's what we were missing all along. And that's why I think everyone's proteins and everyone's makeup are similar, which is also why in families, I see a lot of moms and kids, and I tend to stay along the same medications that if the mom has tolerated, usually the kid will tolerate, and vice versa. There has to be something genetic, some genetic makeup that makes us more susceptible to side effects of certain things and tolerate others.
Yeah, that's interesting you said that. I don't think I actually had that on my list of questions, but I always wonder that, if something is cause a lot of side effects for me, is that something my kids should avoid, and vice versa? If it works for me, should that be what we try first? I tend to be, why not? But not sure of the science behind it, but sounds like you do that too.
Yeah, it's honestly, I think there's more science behind if something works for a family member than to maybe go along that same line. Again, depending on the medication. If there's a side effect, again, you don't know, is it because the medication, was there something else going on in life? We're not sure, but I definitely tend to go on if something worked for a family member, sticking and trying that.
That makes total sense. So the next question here, just to remind people, we do have like 15 minutes left. If you have any other questions, any live questions, please let us know. I still have more questions on my list, so I'm just going to keep going through them. But we will take live questions if you have something you want to answer. That's on topic for this event. So this one is, how long should you give your body time to adjust to a new medication? I don't think there's any answers to this, but I'm interested to hear what you have to say before knowing whether or not it really is a side effect or an adverse event, or whether it's actually going to go away, right? Like say it's not tolerable, I just can't handle it, but I know that it's only going to last for 2 or 3 months and then it's all going to be good. Is there a set time to do that?
I can sort of go through what I typically counsel patients on. Again, it more looks at the half-life of medications, like what we expect their bioavailability in the body to be. So definitely short-term medications or things that are taken more acutely, like for an acute migraine attack, side effects usually appear quickly and then resolve because it's not lasting very long in the body. And those are the ones that side effects can appear depending on where and when it is taken during an attack. It's more looking at side effects of the long-term preventative medications. So if we're looking at sort of our older medications, like the antidepressant class, I usually say we're still building up in the dose over 4 to 6 weeks. So while we're still escalating doses, we're always going to be susceptible to having continued side effects. And then it takes the body probably another 4 to 6 weeks after that initial dose titration to sort of settle into a new homeostasis. So that's why I usually tell people 8 to 10 weeks to really say, is this going to go away or not? The other thing is some medications have different side effects depending on dosage. So one medication I use actually has less side effects as you go up in the dosage because it has different properties.
Right.
So I always say, you know what, when we're on the lower doses, you might feel more tired. But as we go up, I expect your energy to increase, which is completely counterintuitive. So it really just depends on what medication. Same thing with like the beta blockers. I would say at least 2 months. Just again, I say with migraine, any little change, I think about it. Like I didn't sleep well, and I feel like I'm like down for the count for like weeks. So I'm like, this is a change going on in the body. We have to give it time. So if it's something, again, that is completely not tolerable, like let's say you literally cannot keep food down because you're just vomiting all the time for the medication, like I'm not going to wait 8 weeks for that. Like that's just like a no-go. But I do find things like fatigue tend to improve, nausea, dizziness, sort of sleep related these things, and also adjusting when the medication is taken during the day. We can also dose adjust. So it really just depends on the side effect. And I just say, unless it's something that is inhibiting your ability to function, I always first try to find a way to either dose adjust or just modify the regimen, because I've noticed that usually it's time. We just need to give it time.
Yeah, that's interesting. That's helpful. And I'm also thinking, in an ideal world, migraine would be the same every single month of the year, regardless of what if we took medications or not. And so therefore, if you take a medication, if that is caused by the medication or if it's just caused by the season, right? So I'm not wording that very well. I kind of mumbled that. But I mean, I know that migraine is sometimes for no reason at all, it suddenly gets worse. I have more attacks, so I can't, right? And other months it's like, wow, this is amazing. Did they change a medication? No, it's just like random great month.
Random. I had a patient, actually, I saw today that we review, like I've been seeing her for a long time, and I looked back at her diaries from like 2020, and I was like, oh, every summer, like it seems like for no reason at all, you'll have like one good month and then one, but no matter, we don't change anything. And then it's random. It definitely is what you say, random. And then there are other months where it just, things go great. And we're like, did we change something? We didn't change anything. It's just the brain isn't always going to be the same. Things aren't always going to be exactly the same. So medications and how you respond to them won't always be the same. So that's why I say, usually when I look at something, I look at it over a 2 to 3 month period, because the body can go through a lot of different changes in that period of time, and therefore our ability to tolerate medications might change. Also, for women around the period, we might be more sensitive to side effects of medications, or just to medications in general. I think there's just different times, different phases when there's also more triggers being piled on. It's really hard to say in a vacuum.
Yeah, it's so hard to say. And I very often look at my calendar and I'm thinking, okay, that just makes no sense at all. Absolutely no sense at all. Everything looks so random, but over a longer period of time, obviously you should be able to tell if a side effect is getting worse, getting better, if your migraine attacks are getting less frequent, but you're not going to be able to tell in 1 week. So sometimes we have people come in our groups and say, I took a medication to prevent migraine, and 7 days later, I got this horrific migraine. And so I think this caused it. I was definitely not helping. And so, yeah, just need to have the understanding. It takes time, right?
I think expectations. So I say to everyone, I think we need to set clear expectations. We're starting a preventative treatment. I do not expect any improvement for 2 to 3 months. If I get it sooner, great. But like that's my expectation. And if things get worse, it probably has nothing to do with the medication, or if they're seemingly worse. Also, when we're expecting something to make us better and we have bad attacks, it's like the medication isn't working, but I don't expect it to necessarily work that quickly. I always just say, like, it took us time to get here. It's going to take time for the brains to sort of cool down and stop overproducing
Right.
pain. So I
Absolutely.
think if something works in a week, great. I just don't want to
Not,
expect it to
not
happen.
the norm, not the
Yeah.
norm at all. Yes. So a question we actually don't have on our list right now is if I get side effects from one medication in a class, let's say I get side effects from a triptan, does that mean I should not, intolerable side effects we're talking about, does that mean I should not take another triptan? Same with the G-PANs or the monoclonal antibodies. Is it a true across a class of medication, or is literally every medication slightly different?
I think it's a great question. It depends on what the effect is. If it's allergy and you're having hot, like it depends on what it is. But even the triptans, they're the same but different. Like each one is metabolized a little bit different. There's some that metabolize through different pathways. There are some that are nasal, some that are injectable. And it is true, more side effects will happen with ones that are faster acting versus slower acting. So if somebody says, I didn't tolerate that because I had, like, my heart was racing and my jaw was tight and my neck was stiff, I then go to a slower acting triptan because it should have less side effects. If we sort of, I still have them try others and also try to time it differently in an attack and just sort of see if it is a class effect or if it's just that medication. A lot of times it is the specific medication in the class. There's
Right.
also sometimes, like if we're using a disintegrating, maybe it's the flip, like it really just isn't a one size fits all. And I will say
Right.
that even though medications are in the same class, the way that they are made and formulated can be completely different.
Right. Even the same medication, if it's generic, made by different companies. And we see that too, right? They have different inactive ingredients. So
Absolutely. And I will say if, for example, you've always been using the swallow tablet and then you get a melt tablet, there might be something like there's some artificial additives that maybe you
right.
don't agree with. So I feel like before giving up on a class, I do it more strategically and I go through the differences and then still try them. And I always say trying means, like, for a rescue medication, 4 times. Like, 1 time is not a try. I basically
Right.
say, like, I do it at least 3, maybe 4 times. And then if 3 out of 4 times you're not tolerating it, fine. But most of the
Right.
time, it's not every time.
Right. Absolutely. That makes total sense. We had a question that's a little bit off topic. I just want to address it really quickly. Someone said, what happens if you're taking a new medication, I'm presuming a new preventive medication, and you don't have time for it to work? And I think we're kind of get into this in the last 5 minutes of this, is that what happens if you're with a doctor who does not understand migraine? They're not a headache specialist, or don't want to work with you. And so just me personally, and maybe you can address this as well, Dr. Natbony, Dr. Natbony, I'm always concerned when people in our group say, I went to my doctor, I'm having almost daily migraine attacks. He put me on a preventive, but no acute medication, no rescue medication. Not a good situation, right?
I think in the sense there's 3 different classes there. I look at, you have a prevention, you have a rescue for severe, but then there's a bridge. Like I always look at it, I'm trying to like give this like lifeboat, right? Like I need something to work while the preventative is building up in your system. And I think that's where a lot of plans fail, is that you need to wait for it to work, but I'm in so much pain right now, so it's not working. So then it's snowballing. So where I look at it as I say, okay, I know this is going to take 3 months to work. That's where I might have the patient come in for nerve blocks. I might do a short course of a medication that I think would work better as a bridge. Really, it's that bridging the gap that is usually lost. And there are some preventatives that work faster than others. I think also we can dose escalate, go up on doses faster based on tolerability, but it's such a dynamic process and needs so much communication that I think that's what frequently gets lost. And I think I could see that as a patient, I would get lost too. It's like, well, what do I do? And I think not being offered an acute medication, the problem is that if you're having such frequent headaches, you need a bridge, a lifeline in that moment. And I don't have the answer of how to help them because it's very specific patient, but I think it's asking, so what does it, maybe we should have another, what does a bridge mean? Like what is a bridge treatment? If I'm in the middle of, I'm trying to get on prevention, but I feel terrible, what can we do? And that's a
Right.
whole another
Yeah,
topic. And I think
that would be a
one
great
that
topic. Yeah, we can
most
definitely look
doctors,
at doing
yeah.
that.
And I think if we're
It's
able to
huge.
tell patients what to ask for, that might be helpful.
Yeah, absolutely. I think that's great. And I also just want to encourage people, if you're just seeing a primary care physician or a neurologist who it's not working well for you, someone who's not educated in headache medicine, you can go to our website, headachodoctors.net. We have every certified headache specialist in the US listed on there. You could search for them by your zip code and just see, if there are any in your area. Of course, then you also have to navigate insurance coverage, but sometimes it's worthwhile paying for a really good doctor to get your migraine attacks under control, especially if the medications are covered by your insurance. But yes, I just encourage you, please don't give up on that. And it's so personal to every single person, like Dr. Natbony said. So I have two more questions left. One is, if we already have, and this I think is a great question, if we already have some of the side effects listed on a medication guide, let's say constipation or achy joints or anything else, is it more likely that that medication will make those side effects worse or no relation at all?
It depends on what the symptom is and then the medication. So for example, if someone comes in with chronic constipation and then I choose to put them on one of the tricyclic antidepressants that I know causes to dry out, like basically it causes dryness, I know it's more than likely that without other intervention, that is going to make it worse.
Right.
Same thing with things that are known just to make people groggy. But I feel like it depends. Sometimes the medication doesn't have anything to do with it, but I will say it really is dependent on what the symptom is. And that's also how we choose medications and we choose side effects. So I think that in choosing a medication, I never want to give people more symptoms of a condition that they already have, but also sort of it's not a one size fits all. But I
Right.
will say it does depend on the condition and on the medication. I would say if it is something like that is a chronic issue, telling the doctor this is a chronic issue, and then looking at the mechanism of the medication and saying mechanistically, can this worsen? And then monitoring it. That's sometimes the only way we know is by saying, this is my baseline. Here's my
Right.
change from baseline.
Right. Absolutely.
I wish
Absolutely.
I had a test. I'm sort of like, I wish
I know.
I could just have a test that tells me this is what it is. But a lot of it's an art. I feel like it's about recording and monitoring symptoms and discussing them, which is the hardest thing to do. I'm like, if I could take a picture,
Yeah.
if I could take a test and tell you, it would be easy.
It's hard for doctors and it's hard for the patients. So if you're a patient, just remember, this is also frustrating for your doctor. And doctors, if any of you are watching this, it's frustrating for us. It's hard because we want to get our life back. And doctors want to help us get our lives back. But migraine is so complex. I can't wait for the time, and probably not in my lifetime, but when they're going to be able to do a genetic test. And based on that, they could say, these are the 2 or 3 medications that will work for you. These ones you should absolutely stay away from. And wouldn't that be amazing?
I feel like working on it. It's the precision personalized medicine aspect.
Yes.
And I think migraine is sort of the poster child for that. It's because it is so complex because everyone is so different. And that must be so frustrating. I know it must be, it is. And I think as doctors, all I want to do is help, but knowing that everybody just needs something potentially a little bit different.
Right. Exactly. So the last question, I know some people did ask questions that were off topic. And so we did not get a chance to get to them, but please put them in our Facebook groups and in our Instagram page, because if we get enough questions on a topic, we schedule an event on that topic with a doctor. So your feedback is really valuable for us. And the last question here is, so this is where someone wrote, my doctor seems not to want to address my questions about side effects. So not to get on the complaining side of it, or where someone just needs to get another doctor, but for the positive side, what is the best way for us as patients to communicate with our doctors so that they will listen to our concerns?
I'm going to answer this in the best way I can. I think what happens is, as doctors, and seeing it from a doctor's standpoint, when we're seeing patients all day and then we're getting questions like not during an appointment time, it's hard to focus on the patient's complaints. And I always feel like every patient needs to be heard about what is going on. And I want to dedicate that time to that patient. I think with the doctor schedules these days, I know it can be hard, but making an appointment, I feel like making an appointment to discuss what's going on will always get a better response. I know sometimes you can't get an appointment, and I know there's so many obstacles around that, but I think a lot of times things are hard to talk about on the fly when it comes through a portal, when it comes through 5 messages being handed down, because we need that time to dedicate. And I think that's really hard, like I said, because it's hard to get in with doctors, but that would be my main takeaway, is just saying, doctor, let me make that next appointment, and keep a list of questions for that appointment, and making sure that those are addressed.
Absolutely. Yeah, super helpful. You know, in my last doctor's appointment, I actually sent him through my portal the list of things I wanted to talk about. Didn't actually include side effects, but I loved it. And he said he really appreciated it, right? Because you know what to expect from the patient.
Oh, so I always send, before every appointment from the patients, I send sort of a symptom check or a follow-up saying, what is it that if we need to address one thing, like what we're going to address. And the favorite things I get are when patients, today someone sent me this most beautiful spreadsheet, and I was like, I love this spreadsheet. So like before even getting into the appointment, I knew what was going on. I knew what needed to be addressed. But a lot of times we don't necessarily know what is bothering you the most unless you tell us. Migraine is complex. Sometimes it's not the pain that's the most bothersome. And we need to know, this is what I want to focus on. This is what's bothering me. And sometimes you just have to flat out say it, like announce it out there.
This is it. Yeah. So any last thoughts from you before we close out this event today, which has been amazing?
Oh, thank you. I think that migraine can be such a lonely disease, and it can feel really, really hopeless sometimes, especially if you're navigating the medical system and finding the right doctors and the right support. But I always want to encourage everyone to still have hope and still trying things and experimenting with what's out there. It might seem scary, but it also can be extremely, extremely rewarding. And if what you're doing right now isn't working, don't keep doing it. I think that we get stuck in these patterns of repeating and repeating because we're scared to make a change, but sometimes only with change can we really get great success. So I just encourage everyone just to keep on trying and keep on fighting, and know there are good doctors out there who really do want to help and want to really.
Absolutely. There are some amazing doctors out there who really are trying to make a difference in this field. So please don't anyone give up. Thank you so much for being with us today, Dr. Natbony. Really appreciate you. Thank you for everybody who is here attending this live, and for those who are going to watch it afterwards. I hope that you have found this helpful. If you have any comments or questions, again, that have not been answered in this live event, please let us know in our online community, especially on the Facebook community. As Dr. Natbony said, migraine can be such a challenging disease to live with, and we encourage you to proactively partner with your doctor, explore different options, and create a migraine action plan to help manage this disease in your life. Thank you so much again for joining us here today, and we are going